Monday morning. How was your weekend? I hope it was a good one. If not, let's kick off a new week on a positive level. Good morning to all of you. I'm Monica Adams, the real Monica Adams, and welcome into our show brought to you by our friends at Invita Health and Wellness. We had a great weekend. It was a very, very busy weekend. Yesterday, what an incredible turnout we saw at Trattoria Giuseppe for the Responder Rescue Buffet, the Italian buffet dinner. I cannot wait to see how much money was raised yesterday. Once we find out and when they do that check presentation, we will definitely let you know. Nice to see some new faces. Nice to see some people who have come over the years. This was the second annual, by the way, and we absolutely believe that there were more people this year than we saw last year. So that was a great event. Also, just very busy on Friday. I want to thank Liz O'Keefe and her husband Michael for inviting us out to the Isaac Bruce Gridiron Gala. It was so good to see some of my old friends back in my old sports reporting days. So, of course, Isaac Bruce, but also Mike Jones, Mr. Tackle. Now, you remember that when we won the Super Bowl? It was his tackle right there on the 1-yard line. Oh, that was incredible. Now, I've asked Mike to be on the show. He said he would love to. Isaac said the same thing. Isaac Bruce's foundation, they do a lot of the things that are similar to the mission that we have here on this show, which has to do with health and wellness and taking care of our youth. And his Flight 300 program, that's what I really want to talk about. We also saw Warren Sapp there, and oh my gosh, he's hilarious. So I'm hoping to get a lot of these guys on the show in the very near future. And then Nico Smith, Ozzie Smith's son, he performed. Boy, is he talented. Do you remember when he was on American Idol? He made it into the top 10. He got kicked off at number 9. I think he should have gone a little deeper in towards winning. But definitely, so proud of him many years ago. And I had a chance to meet his girlfriend, Jessica. What a beautiful couple they are. So we talked about having Nico on in the very near future and him performing for us. Oh, I love his R&B music. So that was on Friday, just a very busy weekend, but definitely fulfilling. So if you don't volunteer, you might want to look into an organization that's near and dear to your heart because it's so fulfilling to be able to give back and see the fruits of your own labor. We're going to actually be doing something with Dr. Sarah Franco and her husband Brandon as we build beds. It's a Heavenly Bed program. It's a foundation. And we're going to talk about that this week and maybe get some of you out there to help us. They're looking to build 40 beds for those who don't even have a bed. Can you imagine not even having a bed in life? It's the simplest things in life that we take for granted. So that's coming up actually this Saturday, and that'll be up in North County, 9 a.m. actually. If you've got some time on your hands, reach out to me, info@TheRealMonicaAdams.com. Love to see you. Jim and I will be out there helping Dr. Sarah and Brandon and a lot of volunteers that have already said, yes, I want to help that cause. Let me just give you some news you can use if you haven't been paying attention. The Israel and Hamas, 1,200 people have been killed. That is just our hearts and prayers and thoughts go out with regards to what's going on there. I understand 4 Americans' lives were taken of the 1,200. And so we are watching that. It's not to tell you about the attack itself, but it's about to say, how do we change the lives of people to even think to go that route, right? I know I'm trying to do a lot in this mission, but that's it. We're just trying to be a kinder race in general. Everyone is part of one race, the human race, and trying to get everybody to be kinder so we don't see this type of horror that happens in our world. So if you haven't seen that, the attack, again, Israel and Hamas. I want to tell you about the Kansas City Chiefs. If you didn't see, they won 27-20, and I heard the Blues are kicking off this Thursday already. The Blues are starting their game, in their season, I should say, in Dallas. They've been doing preseason games. And then as far as the weather is concerned, this is all you really need to know. You don't think you need to know wind speeds and all of that, but you do need to know what the temperature is going to be like. So today, 68 to 70. We're going to try to reach 70, sunny skies, down into the 40s tonight. So it's definitely getting chillier. You can feel the change in the air. Tomorrow, probably 70 as well, right around that with sunny skies. And then Wednesday, make sure to grab the umbrellas as there's a little thunder and some rumbling of rain that will be coming through, but it's going to be a little bit warmer, actually up near around 80. So again, 70, about 70 today, 70, and then 80. That's for the next few days for you. I again want to say thank you so much for tuning in. I met a bunch of people over the weekend that had not been listening to the show or watching the show. They asked, where'd you go, Monica? And I said, every morning, 7 a.m. You can watch right here on Facebook or on YouTube. So welcome to all of you that are not on social media but are watching us from YouTube. Spread the word. Let everybody know that that's where I went, and it's right here for you, Monday through Friday, 7 a.m., changing lives together on a positive level. Today, we've got Medical Monday. We're going to be doing a little earlier 7 to 7:30, Ask the Doctor segment, Medical Monday with Innovare Health Advocates and Dr. Charles Willey. Today we're going to talk about the diagnostic side of how he will look at something and then diagnose. I'm also going to challenge the Eastern-Western culture balance that a lot of you look for in life as well. Then we're going to talk with Tammie Holland. Do you remember Tammie from her media days? What an incredible talent she is, and absolutely hilarious. Did you know she and I went to high school together? So we'll relive and reminisce our older days, our media days, and then we're going to talk about her fight. She is a survivor and a fighter of cancer. So it's going to be a powerful hour. Stay with us. We have Dr. Charles Willey kicking it all off in the blue chair when we return. Envita Health and Wellness, where you can feel your best both inside and out. Envita isn't your typical med spa. They're a multi-specialty medical spa and wellness center serving St. Louis and its surrounding areas. They have ketamine for mental health and pain, IV therapy, medical weight loss, and aesthetics treatments. As board-certified anesthesia providers, Envita can ensure that their advanced treatments are provided safely with minimal to no pain. So let Envita take care of you. Call 314-394-0950 to book an appointment or online envitahealthandwellness.com. Think about this. When's the last time you called your doctor at 2 o'clock in the morning and he actually answered? Well, at Innovare Health Advocates, their patients are special. Their doctors, nurse practitioners, their care team care deeply about your health, your family, your work, and even your pet. Their clinicians are accessible and they lead your care in and out of the hospital. In fact, Dr. Charles Willey offers his cell phone number to his patients to ensure they can intervene early in your illness. They can provide care above and beyond, offering lab, x-ray, echocardiogram, and other treatments in their office. Innovare Health Advocates with 5 locations on both sides of the river. Check them out, innovarehealth.com. Welcome back. You just saw 7:07 Ask the Doctor segment. We kicked it off a couple of weeks ago, so it's on Mondays. It's our Medical Monday. And actually, this entire hour is going to be talking about medicine in one form or another. We brought Dr. Charles Willey on a little earlier, so from 7 to 7:30, talking with Dr. Willey about your questions, but also things that we want to talk about that they do with Innovare. If you haven't had a chance to see him, let me welcome him on. Dr. Willey, thanks for coming back in, first of all.
Delighted to be here, Monica.
Today we're going to talk a little bit more about how you diagnose. I mean, we talked about the many things you've done in 40 years of an internist, but if someone came into you, and I think other doctors maybe they would go to and say, I'm a little worried about this lesion I'm seeing, or I'm a little worried about what does this freckle look like? Is it dangerous? And other doctors maybe would say, let me have you, go off to a dermatologist. You don't do that. Yours is all encompassing.
Sometimes I'll refer to a dermatologist, but after 40 years of doing this, I'm have lots of experience in seeing most of the lesions and can diagnose most of them by looking at them. Some of them, if we think they might be cancer, we'll biopsy them, and that can be a shave biopsy. If it's a tall lesion, you just slice the top of it off after numbing it up, cleansing, numbing, slice it off, send it to the pathologist, see what it is. And depending on what part of the body that is, if it's proven to be cancer, a skin cancer, then we need to deal with it. Usually cut it out. A great majority of skin cancers are a local problem. Cut around them, sew it back together, and live happily ever after. There are a few, melanoma, the most notorious, that can spread to kill a person. So that has a special treatment in the surgical removal, really well studied, and the protocol about how to deal with that is dermatologic and plastic surgeons.
So one of the things, we're coming out of summer, we're going into fall, people start to layer on their clothes, that maybe they didn't pay attention to something, because a lot of times people don't look behind them, they've got something on their shoulder or on the back, even in the head. I think a lot of times it's really powerful to think that you go to get your hair done, and sometimes stylists, beauticians will say, have you seen this? Because they're the ones that are seeing in the hairline and everything that we're not seeing. But it's really asking someone, a loved one hopefully, can you check. I'm looking over my shoulder in the mirror, and this looks a little interesting. From the skin cancer possibilities, what are you looking for? Because everyone always gets confused by this. What is it that we're looking for that could be alarming?
I've had a hairdresser save a man's life, sent
Yep.
me a melanoma on his scalp. And I always ask, who do you live with, and who
Right.
gets to see your back? And if nobody, I make sure I look. Try to look anyway, but that's an important point. So being aware of what's happening, what's new. Danger signs of cancers, it depends. The most common skin cancer, it will be basal cell. Unfortunately, it's a local problem. It doesn't spread to kill you.
Okay.
But if they're new, they're growing fast. That's probably the key thing for the inexperienced person to see. New, growing fast. If they're basal cells and squamous cells will be a shiny, glistening red. They'll change the architecture of the skin if you use magnification, and these days magnification is also my cell phone. I can magnify 10 times.
Yeah.
Take a picture.
True.
Look at it with the patient, but folks can do that, and I'll patients will call me and ask for an appointment, or I said, take a picture and send it to me.
Right.
If I talk to them, and then we can decide what to do about it.
That's the advancements of the cell phones we actually do appreciate.
Yeah.
Otherwise, we say, put them away. We need to have communication here. We're talking with Dr. Charles Willey, again, Innovare Health Advocates. And we mentioned that you have locations on the Missouri side, the Illinois side. I have had so many people, doctor, this is how great this segment is working. And I have had probably just 5 in the last day that said, I want to go to him. In fact, my mother, who's sitting here this morning, said, I want to go to him. But let me say, although you have locations on both sides, you're not actually at every office. You're not out in the Lake St. Louis one, are you? Because that's what she was asking.
I don't attend it regularly.
Okay, but
That's
you
correct.
would go out there?
I would.
Maybe?
Well,
to see that woman right there?
well, she's driven this far.
Yes.
She's
true.
driven past another of my offices. But
You have offices in Creve Coeur, in South County, in Festus, the Lake St. Louis area, and then on the Illinois side,
in Alton.
Alton, Illinois.
Yeah. And I have a champion young doc who helps me in the north side. That's Creve Coeur and St. Charles County.
Okay.
And a champion younger doc who helps me in Festus in South County.
Okay. And it's, again, Innovare Health Advocates. I know a lot of people are talking about, well, I don't, and that's one thing you mentioned last time. If you have a doctor that doesn't really take the time and is truly caring about you, which is what I'm hearing from some people, they're like, yeah, everything Dr. Willey's saying, I don't feel like my doctor's doing that. And I do think I want to change. That's what you would stress, is that you genuinely care about the person's health and want to do everything you possibly can to get them well.
I think I'm most careful to impugn others. I think most of them care. They're configured. Their business model, their structure, their employer doesn't allow them to slow down and get it right. And that's a unique thing about me that's too complicated to explain here. But my business model, I literally get paid to keep people happy, healthy, active, and alive. If they get sick, it's, how I do economically has a lot to do with how well my patients are and how quickly we intervene.
Right. Well, you're very
Yeah.
proactive. I think
Yeah.
the problem is too many people, they don't go to the doctor when they should because they have a fear of, it's the whole white coat
Yeah.
syndrome. They fear going to the doctor, which is unfortunate. I don't. If I'm going to the doctor, I know that I trust you enough to take care of me and that you're going to diagnose, which is what we're talking about today.
And Monica, a really important thing is I don't have people come back just to come back. I do most of my clientele are senior citizens. Now now remember, I forget if I said it here yet, but middle age starts at 75, old age at 95, right? So
So we're young. I'm like a baby.
yeah, you're just a kid. That's right.
Good.
Me too. And I'll keep changing the rules as we need.
Exactly.
Right. But really important is care between the visits.
Yes.
What's happening between the visits, and call me, tell me.
Well, that's up to us, though, right? We need to be taking care of
It
ourselves.
is, but we have people with serious chronic illness that needs congestive heart failure, for instance, diabetes for sure. We need feedback and interaction. So we run what we call the high risk list. Folks who have these serious chronic illnesses, we have them on a list. We contact them frequently, so we know if their condition is stable or not.
Okay.
So it's not just about the visit. It's about your your life in between the visits. It's having us and being available. We are available. Call us.
Well, you want to give your phone number out?
Sure, 314-359-0413. Now, that's my cell
That's
phone.
his cell
Here, that's
phone.
this one. Here it is.
Don't call during the show.
Don't call during the show. And,
Or InnovareHealth.com.
and here's the backup. AT&T, Verizon, always available.
Oh my goodness. You're just like me. Everyone's like, why do you have two phones? Well, because you're busy.
Yeah.
Yes, so that is truly his own personal cell phone number. How many doctors do you know that will give that out? Not just to his patients, but literally to all of you that are watching the show that are very intrigued by, maybe I want to switch and I want to have this man and his team be my advocate. That's the biggest word, is that you need someone to be your advocate.
Yeah, I give that out. People respect. The great majority of people respect and don't call me, for trivia.
Good.
Right.
That's a good thing.
Yeah. But, here if somebody's curious, they have a medical condition, call. Call
Absolutely.
Monica now. We'll solve your problem right now if we can.
So what I want you to do is, if you have a question, maybe there's something that you've been a little bit frustrated because whoever you've been going to is telling you, no, you're fine. I think, I'm going to speak for all of you. That is the biggest frustration that we all have when we know our own bodies and we go to a doctor and the doctor's like, nope, there's nothing wrong with you. Well, as a doctor, say something to us to help us with that comment, because we know, no, this isn't how I'm supposed to feel.
Well, let's see. I try to never say never, never say always in this business. And hopefully I've never said there's nothing wrong with you. Because you, at a minimum, you're concerned and you're worried.
Right.
So is that something wrong with you? That's something you're concerned about. So we have to get to the bottom of that. And, I better listen. I better ask questions into it. People get annoyed sometimes. I ask too many questions. Well, I'm trying to sort out what you are feeling, what you're experiencing, so I know how to solve the problem.
I'd rather you ask more questions.
I do. I ask lots of questions.
So some people get annoyed by that, though. Why?
I think maybe they're used to, maybe by the time they get, well, I don't know. They're used to filling out a lot of forms and
Right.
And here it is, that and get an action, But I got to sort it out. I could send you down the wrong path, and a lot of people spend a lot of time in healthcare. It's at a minimum a waste of time, waste of money. But it's dangerous because if you get down the wrong path, you can get a surgery for a back pain that's not a surgery for a back pain, for instance, and it's not the cause of your pain.
Right. There's a gentleman that we interviewed that had, speaking of back surgeries, he had, I believe, 13 surgeries. 11 of them, they're saying, probably really didn't need to happen. 2 of them definitely did, but he said, can you imagine 13 surgeries later, and I probably didn't need to have 11 of them. I mean, who wants to go through surgery? It's never easy coming back from that.
Yeah, so, the back is complicated. There are a bunch of moving parts. The good Lord was a heck of an engineer, and that spine really works, but I don't know, sometimes I think maybe he didn't imagine we'd live this long. But then did Abraham live 900 years?
Right.
Or not. But, the spine, the pinched nerves, there's joints, ligaments, the disc, the spinal cord itself, the branch nerves, sacroiliac joints, the hips, muscles, tendons, itises, bursitis. There's a whole bunch of structures that can hurt. So you really have to interview carefully. Wise medical school teacher, doctor, 90%. I think it's been studied, but something like 90% of diagnoses are made in the interview. Right?
Sure.
And then the physical exam adds 2 or 3%, and tests add 5%, and the other few percent we're still searching. But it's really important.
I think one of the things, again, if you're just tuning in, I know a lot of you come in every second. Dr. Charles Willey with Innovare Health Advocates, and I've got my tablet here. So questions, please don't be shy. If you have a question about your own health, ask it every Monday. He's here to answer your questions. It's the Ask the Doctor segment. I'm going to get into roses in just a second. One of the things I wanted to say is I've seen, as a personal trainer for 25 years, I've seen too many people go in and... Again, this is why I want you to seek and research good physicians. They've had surgeries done when a lot of times what we call runner's knee is really a tight IT band, or they've got a piriformis issue, or they've got an SI joint issue. And if they would do more yoga, stretching and release this, or foam rolling, suddenly that pain goes away. And I've had many people who've had surgeries because they believe they had a knee issue, and they're like, oh, I guess I have to have surgery. And then the doctor went and did surgery. And I was like, but did you ever check if this is just tight that relieves that pressure, relieves that pain? Those are the things that frustrate.
Yeah. So you mentioned piriformis. That's deep in the hip girdle and difficult to find. But another adjunct I have more recently, since I moved my office, I met a Dr. Cox, who's a interventional radiologist who uses ultrasound exclusively for diagnosis, and he's got a higher frequency ultrasound. He's an expert. So musculoskeletal ultrasound. He can see inflammation in the muscle insertions. Muscle turns to tendon to attach to bone, or fascia is kind of a broad tendon. The iliotibial band that you mentioned is a fascia.
Right.
So we can see inflammation in those. And another catch, I had a elderly gentleman who was convinced he needed a spine surgery. His back hurt. And another confounding issue is referred pain. The man's problem was his hip. He needed a hip replacement. I was pretty convinced of it, but I couldn't convince him. So I sent him for a hip injection. Now I can inject the greater trochanteric bursa if you feel the knob on but the hip joint is deep. So I sent him, I said, now I want you to pay attention to the first 30 minutes after this injection, because they put numbing medicine in. So when you walk out of there, if it feels good, that tells us we're on the mark. And he did. He said, oh my God, doctor, my back pain went away.
And here he was ready to have back surgery.
Ready to have back surgery. And he had, he was elderly. You take an MRI of that spine, you'll find something you could operate on.
Sure.
There's let's see, I just said never say, always, never say
Never say never, and always.
But you won't see an MRI of somebody's spine who's north of 60 years old that'll say normal.
Right.
Right. So he could have had it, but it helps us sort it out. And Dr. Cox works that way as well. When we inject, we'll use the numbing medicine first. Hey, is this it? That tells me, yep. Oh, it's great. Oh, I'm on the mark. Put the anti-inflammatory in.
I tell you what, just to look at what you're able to use in medicine these days to see inflammation, to see arthritis, which blew me away when I was first told. I'm like, you can see arthritis? That's fascinating to me. All those things. I'm going to take a quick break, and I'm going to get to some of your questions that are coming in. So if you have one, again, we've got about 7 to 10 minutes left. So be sure to comment, and then I will ask the good doctor the questions. We'll have more with Dr. Charles Willey when we return. Hi, it's Monica Adams, and I just want to say thank you so much for following along since we launched The Real Monica Adams Show back in March. But I wanted to let you know there's so much more that our team can do for you. From styling to emceeing to life coaching to personal training, motivational speaking all around the world. If you have a company, a corporation, a business that would like to book us, email me, info@TheRealMonicaAdams.com. Let's change lives together in person. Info@TheRealMonicaAdams.com. Welcome back. It is 7:23. Let's go straight to your questions because I see a lot of them coming in. So, Doc, Rose says, I know you're not an OBGYN, but they say now women over 60 don't have to go but every 3 to 4 years or don't need to go at all. Ooh, I have not heard that. Any thoughts on that?
Yes, that's the trend. So it turns out that, so why would a woman see a gynecologist? Breast exams, okay. Self-breast exams and mammograms can be ordered on their own. So that's one reason. The other side is gynecologic issues. So especially if they've had a hysterectomy or their ovaries are gone, there's very little that comes up if that's not indicated by symptoms, okay.
But if they're having a symptom, then
absolutely
they should,
bleeding, itching, discharge, all that stuff.
Right.
Go see, but to see them on a
like a yearly.
And I'd have a relationship, and use that relationship and that doctor's advice about your specific circumstance.
Okay.
Because we are, as much as we try to find patterns in a bunch of humans, there's always somebody who's got it a little different.
Sure.
right?
Well, I'm glad she asked that because I'm going to ask the other question because it's always confusing for women who are 40, 45, 50 years old. When do you recommend that I guess they first have mammograms? Because that seems to have changed over the years as well.
Especially if there's a family history.
Oh,
You
yep.
know, 1 in 10 women will get breast cancer. If it's in the family, 1 in 4. That's really common.
So you would tell them to start having a mammogram at what age?
At least 40.
Okay. Because I think that had changed over the years as well.
And if it's in the family, you know, get the genetic testing, and that's being recommended with more regularity.
Okay.
You know, breast cancer, especially, you know, breast cancer. There's sort of two breast cancers: before the menopause and after the menopause. And the breast cancer before the menopause, unfortunately, is much angrier disease.
Before, okay.
Before, more difficult to cure.
Okay.
So, and after, the further after menopause, the easier it is to cure. But boy, keep an awareness. Keep an awareness of your breast.
Well, those self-exams are so important.
Absolutely.
I mean, I know so
Something's
many doctors.
different. Come and run it.
Say that again?
Something different.
Yes.
Come run it.
Right, and even the easiest, I've heard every doctor say, the easiest is when you're in the shower, right? Just see if something has changed, and be aware of it. This is why we're talking about being your own advocate. Someone wanted to know the question about shingles vaccine. I know people have been, yes, when you turn 50, be aware of this. What's your viewpoints on that?
Well, I'm a little sassy about this, but the current shingles vaccine works.
Okay.
It's useful. The first one, we spent $15 billion immunizing the senior citizen population, Medicare beneficiaries, with a vaccine that didn't work. But this one works, so go get this one.
Okay.
Yeah.
Okay.
And shingles is becoming more common. One theory is that since we have chickenpox vaccines for the kiddies, it used to be. I remember my older two kids. There were chickenpox parties. The moms would decide.
What would that be that we're looking at?
Boy,
That looks like, is that more like a psoriasis, rosacea kind of a thing?
it's
Or I'm wondering if would that be anything looking like shingles?
no. It's shingles comes in a stripe.
Okay.
Those look like inflamed oil glands.
Okay.
Okay, that's a different. Looks like more of on the eczema flavor
Yeah.
or. But shingles,
So shingles is striped, and isn't it on
Shingles-
one side of the body?
it's one side of the body.
Okay.
It travels down a nerve. It's the chickenpox virus that you had when you were a kid. That's psoriasis.
That's psoriasis.
Yeah.
Again, all these things are frustrating, though. I mean, again, that's why we're saying we're not just going to say nothing's wrong with you because
Yeah.
you know that's not how your skin looks.
But here's the thing about shingles. The key, if the shingles, the first thing that happens is a sensation in the skin. It'll be on one side of your body. It might feel like a fly bite, but it keeps happening all day long.
Oh.
You know, a persistent itch. If you have an itch and you stroke it, and it makes it worse, it's even stings. Think shingles,
Okay.
and come a running because if we treat it right away with an antiviral, we can make it a nothing.
Okay. Yeah. Don't
But
dismiss it and have
it can be a heck of a lot of misery if you let it get
Let it
away.
go.
And the rash usually comes a few days or a week after that sensation. So
Doesn't stress bring on shingles?
it's
aggravate?
That's a theory.
Okay.
And maybe.
Okay.
Yeah. Certainly immunosuppression does. Things that we know aggressively immunosuppressed, like cancer treatment, can make it more evident. But
Okay. Let's see. So if you need to have the COVID booster, do you need to have the COVID booster and the RSV shot? I got the flu shot. What is the difference in the RSV and the booster?
okay, respiratory syncytial virus is a virus that's been around and in the milieu for a long time. It's many people get a cold and it's it's RSV. Okay. It's dangerous to infants and immunosuppressed children for sure, and adults somewhat. They're proffering a RSV virus. I think I haven't been recommending it, and the new COVID vaccine. The COVID looks like there's a new phase of it that's a little more miserable than the last phase.
Really?
But I haven't, and we're having a few people be admitted. But mainly, again, as I said before, it's exacerbating chronic illness. Otherwise, it's like, depending on the opinion, it's a mild case of the flu.
Right.
A day of achiness and feverishness. But it hasn't become a lower respiratory illness like
it in the beginning.
Like the first two variations of it.
Okay.
So I think the COVID vaccine's optional.
Somebody said, I really like my doctor, but his staff is like dealing with nurse rat shit. Makes me dread calling the office. And then she capitalizes, they will not let you ever talk with the doctor without an appointment.
Yeah. Well, again,
But here he is giving out a cell phone number.
We have to be available. So if we listen to our feedback about our staff, and they coach me if ever I get grumpy.
They're the go-between.
People are afraid of me because I don't know.
We're talking about Innovare Health Advocates, and I knew it. Every Monday, we go through the questions so quick. Somebody did say, get your life insurance before genetic testing. That's from Kathy Kelo-Peterson, by the way. You're going to hear about her in just a second. And she said the same thing I just said. Her theory on more cases of shingle is that she feels there's more stress in people. Don't know. I mean, again, there's so many theories out there. InnovareHealth.com, and I know a lot of you are frustrated with your doctor. I'd love for you to check into Innovare Health Advocates. Again, they've got many locations on both sides of the river for you. I just don't understand why anybody would continue to go to a doctor that they don't absolutely love. This man, look, my good name for 30 years. I'm putting my name behind this man. I used to work for him when he was with Essence Health, when we were doing an incredible program at Friendship Village for 3.5 years, and I still am dear friends with a lot of the patients that we had there. Beautiful to watch them be their own advocates, do exactly what you ask them to do, which is exercise, move if you can, eat healthier, try to keep the stress out of your life, try to surround yourself with supportive people that keep you in a positive mindset, because you and I both say mental is a big part of this.
All day long.
To try to get rid of the depression that a lot of people see.
Depression's very common,
Yes.
Causes a lot of trouble.
So we're not going to be able to get into it today. So I'm going to hang on to this. I'm going to say right now that next Monday, because we talked about it a little bit in the hallway, but I think it's going to need a bigger, full-blown Monday discussion. And I know a lot of you have asked me, so what does the good doctor think about Eastern, Western culture medicine? I'm not going to do it today because I think we have much more to talk about. But I think it's going to be a pretty in-depth conversation in 40 years and 30 years of interviewing doctors of how I've seen it change, but your viewpoint. So don't say it yet. I want to give your viewpoint on Eastern, Western culture medicine. Once again, let's give your information. It's InnovareHealth.com, and that's to find out a location that would be near you. And then go ahead and give your number again.
314-359-0413.
Okay, he is there for you, an advocate for you, and bring your questions again every Monday. Next Monday, we're going to have them on at 7:30. So if you do, by the way, have a question and you didn't get a chance to get it in live, email me, info@TheRealMonicaAdams.com. I'll make sure that I get them to him in advance so that we can address that for you next Monday. Doc, thank you so much. Good to see you again.
Thank you. Still having fun.
We will. Dr. Charles Willey.
Right.
We're going to continue talk about medicine with a very dear friend of mine who's been through a cancer fight. Survivor and now a fighter all over again. Tammie Holland joins us in the blue chair when we return.
It's the icing on the cake.
The final brush stroke.
The finishing touches make all the difference in your home, too.
Have fun and get started at carolhouse.com/room planner.
With thousands of accessories in our 3.5-acre showrooms.
Get your picture perfect room and the lowest prices in the country at Carol House.
Because you like nice things.
You know, of course, it's great to get outside and enjoy the warm weather, but when it's time to relax indoors, be sure your home stays cool with equipment and service from my friends at Aldon. 24-hour emergency service available. At Aldon, it's their commitment to continue providing above and beyond HVAC service for all of their customers. They truly care about the air you breathe. Call them today at 314-567-5585 or on the web, aldon.com. That's al-don.com, 314-567-5585. Welcome back, 7:34. Isn't he great? Once again, every Monday, Ask the Doctor, Medical Mondays with Dr. Charles Willey and Innovare Health Advocates. So bring those questions next week, and I'm going to challenge him. You know, I'm very big on the balance of Eastern and Western culture medicine. He is definitely a Western culture doctor, so it will be very interesting to see what his viewpoints are. But hey, you've got to be your own advocate. We're going to continue to talk about medicine in just a bit, but I've got to welcome a very dear friend of mine from back in our high school days, Tammie Holland, now in the blue chair. It's so good to see you. Let me bring this into you.
Oh, thank you. Okay.
It is great to see you.
It is wonderful to see you. Can I just tell you that you're really good at what you do, Monica?
And so are you, my friend.
I'm
Come
losing
on.
my earring. Yeah, thank you so much. You're so sweet. Good morning.
Good morning to you. If you don't know this beautiful soul, this is Tammie Holland. There you go. Media icon, cancer fighter. We're going to go all the way back, though.
Is that what it says
Yes,
about me?
Yes.
Okay.
Yes. Is that what it says about me?
Okay.
We're going to go back. So she and I have known each other for a long, long time, back to our old high school days. And we've got a picture of our high school. We went to St. Thomas Aquinas Mercy.
There's the Falcons, home of the Falcons. Yeah.
We drove by it the other day. We went up to Florissant for a dear friend of ours that passed. And we drove by and I was like, high school. I'm like, oh my gosh, our old days.
Yeah.
And you saw what it said there at the bottom. That's what we were known for. Soccer champions. What an incredible soccer school it was.
It was a great soccer school. I never played soccer.
But you cheered us
But
on.
I cheered on every championship team.
Yep.
It was a complete joy. We had some really phenomenal standouts to come from Aquinas
Well,
Mercy.
I think the thing that was exciting is everyone knew that when the boys were playing, it was, this team is incredible. I mean, Coach Vince Drake, what an amazing coach.
Yeah.
He had soccer champion after soccer champion
right.
for men,
That's
right?
right.
And then the women come in,
Right.
and we ended up winning state one
That's
year.
right.
Our
That's right.
sophomore year, we won state against DeBerg. And I think that was the only time that the women had won there. But we had a good soccer team as well, the girls and the guys.
That's right. That's right. And you were obviously
I was the goalie.
You were a great part of our success, and we
is all
we
a team.
appreciate
It was
that
a team.
for sure.
It was a team. What's your favorite memories from high school? I think we've got some high school friends watching today. I posted, we've got an Aquinas Mercy class of 1989. I cannot believe 1989 when we graduated.
You know, one of my I have so many favorite memories, but one of my favorite memories, I have two. One is Craig Hopton and I. Do you remember Craig Hopton?
I do remember Craig.
Craig Hopton and I auditioned for a play. And his audition song just floored me. He sang a Prince song, and I guess maybe it would have to be. He'd have to be here to make it funny.
What was your part?
I don't remember what song I sang, but it was that he broke out with this Prince song. Everybody else is doing songs from Mame or, My Fair Lady or Meet Me in St. Louis. And then he breaks out Black Day, Stormy Night. And everybody in the room, everybody's like, okay, yeah, that's great. And then the second one, I don't know how funny it is. I mean, I chuckle at it now, but my freshman year of high school, I wanted to become a nun.
You did?
I wanted very, very much to have a religious life. So I went to Sister Mary Charity Grace and Sister McKenna. Do you remember them both? Mm-hmm. And I told them, listen, I want to become a nun. Sister Mary Charity Grace said to me very, 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 very sternly and very matter-of-factly, she says, Tammie, you're not even Catholic. She says, go talk to your mom. See if she'll let you become Catholic and then come and talk to us about becoming a nun. She says, but in the meantime, we have a club that you can participate in. And I'm thinking, oh my goodness, a nun has asked me to participate in something. Oh, I'm close to Jesus. I was so on fire and I was so happy. And she says, we get together once a month, we pray, we have a good time. And I said, well, that's great. So the name of the club was the Pro-Life Club.
Oh.
I thought that pro-life meant that you just prayed, that you would get together and you were pro-God, and that I was 14 years old. I did not know.
Right.
I didn't know, and so we went to a convention.
Oh, did you go?
So the first outing with the Pro-Life Club, the prayer group that I thought was to this convention, and I was so on fire for Jesus. I was so on fire. And so I get this, they said, there's this permission slip, you got to get your mom to sign it. So I give my mom this permission slip. She knows right away. She
What
says,
pro-life
Tammie,
is.
she says, Tammie, you want to do this? This is a convention. Are you sure? I said, yeah, I want to do this. I get downtown to the convention. I'm on fire because I rode in a car with Sister Mary Charity Grace. Do you know how huge that was for me? It was major. I wanted to become a nun, and I'm with Sister Mary Charity Grace. I'm in the car. Sister McKenna's humming something. It was just the best, right? I get down to this thing, and all of a sudden, I see these images on a screen, and I'm like, whoa, whoa.
Where am I?
Hey, sister, this is not exactly what I thought it was. She's like, shh, 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 shh. Let's talk about this later.
We're
They
here.
never,
You're
they
in the
never,
throes of
they
it.
never invited me back. They never invited me back.
No, that is funny.
No,
Yeah,
they never did.
absolutely. Well, there's a lot. Look, we could go on for hours about our days. I actually surprised Tammie. My mother's here today. I'll never forget you staying at my house.
Yes.
And, and waking up, and you and I used to talk about this, and you're like, what did your mama make me? It was some kind of an egg bake, right?
Yes, it was an egg bake. And I'm sorry, the things that we did to your mother's egg bake. It wasn't quite ready yet.
Oh,
but
that's
we,
not high
yeah.
school, but this is when we run back into each other.
Listen,
So you and I had...
you listen, I have always been so inspired by your fitness journey and your commitment to your health and your body. Like, you are, whoa, girl.
Hello, look at you.
Girl, I'm sitting here in a moment. What are you talking about? Please, I am covered up because I'm a little fluffy now.
You're not fluffy.
Yeah, but I'm taking it. However I come is however I am.
That was the mayor's ball.
Okay, yeah, we were there.
That is such a good time. If you've never been,
Sassafras
yes,
there.
the mayor's ball is a
Yeah.
blast right around Mardi Gras time if you've never
Yeah.
been. And then there's the beautiful woman all over town. You get a
Such an
chance to
honor.
see that,
That
right?
was
When
such
did you join Brown and Crouppen?
19. So in
2019?
2019. Yes.
And you know, this is interesting. So Tammie is well known in media. Actually, I remember you calling me and you're like, I think I want to get into the business. And I said, you have to. And you said, you think? I said, you have to. You have an incredible voice. Beautiful, beautiful. On so many levels. I don't know, Monica. I don't know. And I said, go for it. And so you went to Broadcast Center.
I did.
As did I.
I did.
There's her working in radio, by the way.
Oh my gosh.
With Tony.
Look at there. Yes.
So you worked with Magic. You worked with The Beat,
Yes.
iHeartRadio. You
Yes.
worked at Channel 5.
Yep.
Before
did.
I worked at Channel 5.
I did.
Right?
I did.
What was, I mean, I know you're not doing that anymore, nor am I. We go out. You and I had a great conversation on the phone. I just got chill. And she's like, Monica, you're affecting lives. How you say it?
Well, you know what? Sometimes we can make a greater impact in circles in which we don't believe are very large.
Mm-hmm.
But I believe in what you're doing right now. I know 100% that you are making a humongous difference in the lives of those who wake up in the morning with you and who choose to seek your programming. You've got great information, Monica.
Well, I think, Tammie, thank you. But the biggest reason is you and I both want to provide positivity to the world. There's too much hate and negativity that's out there. And so it just kind of came to me one day of, gosh, I'm waking people up every morning and delivering the news to them. And this is how their day's starting. Horrible things are going on in our world, but then we're just moving on. Nothing's being done about it. It's just, here you go, lay it out. We're just going to move on. And I'm going to give you some of the things. Like I started the show this morning. Please be aware of what's happening in Israel and Hamas. But what can we do? Let's pray for them. Let's try to send money. Whatever it is that we can do, don't just say the news. Do something about it. She and I both will forever feel blessed for the media background that we have because it gives you the following that you have, right?
Yes.
But Tammie actually mentioned to me on the phone when we talked last week, and she's like, Monica, if I didn't have my family at Brown and Crouppen, I don't know what I'd be doing right now, right?
Yeah, this is so very true. I do appreciate the fact of having the opportunity to do this particular work and do it, I'd like to say my way.
Right.
And my way is oftentimes, yeah, there's my Terry. It's like yours, and it is also like the Brown and Crouppen way. Mm-hmm. We all have something in common. We like to share good news stories.
Yes.
Good news stories. impact and make a difference. Just like you said in the beginning, there's so many horrible things that are happening in the world, but our forums allow us the opportunity. That's my Andy. That's Andy Crouppen. I almost wore that shirt today. I'm so glad I did.
You look good in pink.
I almost wore that shirt today.
Let me ask this. Did you know Andy and Terry? So I've not met either one of them. I mean, I obviously know of them, but did you also work with Ron Brown?
Never worked with Ron, but I knew Ron.
So Ron, this is interesting where this will tie us together even more. So Ron had reached out to me years ago. I used to personal train him at his penthouse.
I love it.
Yes.
I love it.
But I never had a chance to meet Terry. So Brown and Crouppen, obviously storied history here in St. Louis. You team up with them. You were doing your show. You actually just started it back up again, right?
Yeah, so I'll just tell you the story really quickly. I worked in radio for about 20 years in St. Louis, and when I separated from the radio company that I had worked for a number of years in 2017, I got a phone call. So I was let go on a Friday. And on a Sunday morning, I got a phone call from Terry Crouppen. Now, mind you, I had a wonderful working relationship with Terry over the years, as he had always been a great advertiser on the stations in which I worked. But to have had him to call me that Sunday morning to me out of the blue was quite remarkable. He called and very matter-of-factly he said, "Hey, kid, I heard what happened to you, and I think it's terrible. I don't know what we're going to do, but we're going to do something.
I love it.
Let's reconnect and let's do it." So we had several conversations from 2017 until, January, whenever it was that I started working with them in 2019, about how we can do media in a different way and how I could use my platform to be of help to Brown and Crouppen. And we sat down, we got it together, and I think that we have a very interesting rhythm now. And this rhythm that I have, thanks to them, allows me to continue doing what I say, my thing, right?
My way, my thing.
My way. Well, it's not really my way, but it's
what connects with you.
I think, right. And I think I would like to believe that they're good things, right?
Absolutely.
To be able to highlight good things about a business that would not necessarily receive love or attention. Right now, I have a brand new podcast. This week with Tammie Holland, the podcast, allows me an opportunity to have, just like you, but unique conversations with people that I really, really admire. I only want to talk. Where's the camera? I only want to talk to the most interesting people. Only the most interesting people.
Yep.
Well, so that's what I'm doing.
That's where you and I are absolutely alike because, I ran into a bunch of people yesterday at the fundraiser we did, and so many people were coming up, I love watching you on Channel 2. And I said, well, I left there back in 2020.
Right.
That's right. I said, then I was at 5, and now I'm at either of them. What? Where are you? And I started telling them about the show. Oh, yeah. I said, don't you want to see what's going good in the world, what's going good in the faces you see that you walk down the street? Everybody has a story. Yeah. And let's tell and pull out the positive side of it. And the businesses, I always say, I love to see the sponsors that want to be a part of this, but you have to align with my mission. If I go into someone's business and I see how they treat their employees and it's horrible, I don't want you on the show. You don't align with, I want you to listen to the show because I want you to get more positive. Yes. But it's that thing. We have great people in St. Louis. I know you love St. Louis. I love St. Louis. We are here. This is where we grew up. Yes. And we want to see it better. I mean, there's been a lot of hate that St. Louis has seen. There's the spotlight that shined on our area. But we're trying to pull ourselves out of that. We want people to go downtown and support the city instead of saying, I will not go into the city. Right? It's all those things that are just hate, hate, hate. And instead it's what can we do as a human race to be kinder human beings? That's what we both want. That's what she highlights on This Week with Tammie Holland. You just had Denise Times on, who, by the way, I love. That woman can sing.
Yes. Denise Times is a rare talent. She's a beautiful woman and just a great person. I had the pleasure of sitting down and having a conversation with her. We talked about everything. We talked about her children. We talked about, her start in music, college. We talked about, what inspires her, what is giving her the fuel to continue on. And these are stories that, that I want to be able to share with others, because I think, Monica, it's really important. Sometimes maybe you and I might take for granted the fact that, this is what we do. It's like walking for us. It's eating. It's, it's just what we do. But for other people, maybe not so much. And so something maybe that you might say or something that I might say might impact somebody in a greater way. And hearing stories, real life stories, really, I believe, can make all the difference in the world, because you can listen to a Denise Times and say, she's in her 60s and she's still trying to grow and reach and achieve things. I want to be like that too.
Yes.
I think that's important.
Well, it is, and it's one of the things we always talk about is at any given point of time in your life, go after it. There are people who literally have changed careers at 50, at 60. You have a lot of life left, I hope, or that we're blessed with the breath in our lungs and just take a hold of it. Why just go through life? Look, this woman has learned that. I learned it when I was 19. I am blessed all these years later when the doctors said to my mother, she's dying today. I didn't. I'm here. That's why I want to make a difference. This woman has had the fight of her life and is still doing so. So that's the part we're going to get into next. If you're just tuning in, if you have any questions or comments, or maybe you listened to Tammie over the years and you just want to say thank you for any point, please let me know. I've got the tablet here. If you have any questions for her, let us know. We're going to take a quick break. We have more to talk about with Tammie Holland when we return.
Hi, it's Monica. Launched the Real Monica Adams Show back in March, but I wanted to let you know there's so much more that our team can do for you, from styling to emceeing to life coaching to personal training, motivational speaking all around the world. If you have a company, a corporation, a business that would like to book us, email me, info@TheRealMonicaAdams.com. Let's change lives together in person. info@TheRealMonicaAdams.com.
Welcome back at 7:51. By the way, I mentioned earlier, I want to thank Kathy Kilo Peterson. You are hearing of all our incredible sponsors, and there she is. Love that woman. In fact, you're going to hear her story, and boy, is it going to blow you away. Tomorrow, she will be our guest. Kkilo.com, by the way, is her website. 636-561-6460. And between Kathy and her staff, they have over 100 years of service. You want to talk about a woman who truly cares about you. So if you need home insurance, you need supplemental life insurance, maybe something for your car, boat, your motorcycle, whatever it is you need, she said, hey, you can call and you can ask for a free quote and they'll give you a $25 gift card. What do you have to lose? The woman is going to tell you her story tomorrow. And I'm just saying, it will make you cry. I just cannot believe what she's been through. But we all have that, right? We all have some story in us. And I just want to tell those stories. And then it makes you go, oh my gosh, look what she's overcome. Well, speaking of overcoming, I just have been enjoying some time reminiscing of our old days. You know, we talked about going to high school together. We got back together. I was dancing. She was doing the host aspect of it. And I loved having my friend there while I was dancing. It was just awesome. We ran into each other at the mayor's ball and always would connect over the years. I would see things that she had on social media and I was cheering her on. And then all of a sudden I saw what I did not want to see. A very dear friend of mine having cancer. And not just cancer, but stage 4 colon cancer.
That's
you
right.
were diagnosed with that how many years ago?
I was diagnosed at stage 4 colon cancer in July of 21.
21.
Yes.
Wow, it's very, but it wasn't just in the colon.
So the cancer had metastasized to my liver, my lungs, lymph nodes, and
So-
I was pretty sick.
The video we were just seeing, you spent a lot of time there. We were looking at Siteman, and so that's kind of became a part of a home for you, back and forth. And one of the things is, you know, when you find out and you hear that from the doctor, and you're in this video, he was going through and showing you, right?
I think there he's showing me exactly where my cancer was. And I'm going to just really tell you, something that happens in life when you get sick, it's like you become this expert at all these, you know, terms and all this stuff. I'm like, what am I looking at? Because to me, it looks like a big blob,
Right.
nothing. I don't know. And, and my wonderful oncologist, Dr. Benjamin Tan, who has just been really a lifesaver, explaining everything that he's showing. I think that, he's showing me a tumor that was near my lung at that point. And that's what I'm dealing with right now. So that's the thing with this colon cancer. So it starts in the colon, and then it just starts working its way up through the body. And so I'm dealing now with a little lung cancer. So there were some smaller nodules that had been treated, and I'd gone through radiation, but we just probably needed to radiate it a little bit more. So I'll begin a new type of therapy. It's called proton therapy, and it is it's a different type of a radiation treatment. Yeah, that is a tube that you go into to get yourself all checked out. See, I was never that one. That's me ringing the bell.
That's the biggest thing.
That's me ringing the bell.
And
I rang the bell
was when?
after I had gotten rid of the cancer in my colon.
This is
Monica.
you, right? This is you. Not you're dealing with your own demons of everything that's going through your body, and you are out here cheering for someone else.
Yeah, on this particular day, the man that was in the bed next to me, it was his birthday, and he was kind of down. And I had become a master at getting food delivered to myself during my treatments, and so I figured out how to get pastries delivered to that unit. So I got it delivered for him. We sang "Happy Birthday," and I'm hoping
Look
that
at you. I mean,
I'm
look
hoping
at your outfit.
that
You're
it
awesome.
brightened his spirit. But that's what I think that helped me out a lot.
Sure.
Monica, was being able to pray for others, cheerlead for others, and anticipate my breakthrough and anticipate my miracle. And I believe that a miracle did happen in my life because I was super, super sick. I credit 100%. I credit the phenomenal doctors and nurses and technicians, the staff at Siteman, at WashU, at BJC for saving my life. But I am a God girl.
Oh, I was just going to say, and the community that has prayed for you.
Oh my gosh!
And I mean,
we're two or
hundreds
more
and hundreds of
gathered.
thousands.
Come on now.
Yes, you and I. Give me your hand.
Yeah.
You and I are very, very faith-based. I love this woman.
Thank
It
you.
broke my heart
Thank
when
you.
I saw the video
Thank you.
of you crying.
Listen, because I was shocked. And I want to say that I wish that I could cry more. But sometimes, Monica, I can't even cry. But at that particular moment, I was so shocked. And my sister was documenting this. I knew that I had cancer, but I didn't know how much cancer it was. And so I'm thinking, when he's telling me that, Tammie, it's going to be stage, I remember like in my brain, like I had I had the dice in my hands. I'm, come on, 2, stage 3. Oh, stage 4 is what you're saying to me? You have got to be kidding me. It was just a shock.
Well, the initial shock and then the realization and then drop the knees crying.
Yeah, man.
Because, well, for so many reasons. Obviously, you have so much life left. And one of the reasons is that beautiful daughter of yours. Yeah. You can't imagine leaving this world and having her without her mama.
No, but it happens to plenty of mamas. And it happens to plenty of daddies. And I give thanks to God for the time in which he has allowed me to spend with his child. Yep. Because Meadow belongs to him too.
Absolutely.
She's not just mine. So I give thanks that he's allowing me to hang out with her.
She's how old now?
She is 17 going on 32.
She's beautiful. And, my mom's in here probably remembering the years of this beautiful woman singing.
So
Do you remember me? I used to always go, oh my gosh, you're like my Whitney Houston. Do you remember I used to say that?
Yeah, girl, I don't even know where you
Because
you get
remind
that?
me of her.
Really?
Oh God, you're such a beautiful woman, just aesthetically.
Thank you.
Your voice reminded me
Listen,
of hers.
let me tell you something. If my voice was anything like Whitney Houston's, I would not be sitting here. I'm kidding. I would come back here for you. I would come back here for you.
Sing for me?
But girl, I would be gone. I would be so gone up out of here. You don't even know. If I could sing, Monica, I would be singing all the time.
sing.
I'd be, Monica. I'd be singing all the time.
Here,
No, Monica, I am not. I am not.
The greatest love.
Of all. You did it. You sound, Monica, you sound beautiful.
No, this girl can sing. Let me tell you. We need to do a little karaoke or
Oh,
something.
I remember you and the karaoke. I so remember
I
that.
haven't done it in years, but
You
I
know,
want to.
Monica, there's
What?
really nothing that you can't do,
Wait,
girl.
Listen to you.
No, but I mean it. You're the one. You're the total package, girl.
You are. Oh
You
my
are.
goodness.
Okay,
Everybody,
okay,
by
but
the
we're
way,
just cheerleaders for each other
It's
today.
it's the no-co girls.
The no-co girls,
Oh
right?
my gosh, we should start our own little
The
group.
no-cos, right?
The no-cos.
The
All right,
no-cos.
everyone, again, if you're just tuning in, we're talking with Tammie Holland. And yeah, I told you we would laugh today, maybe a little teary-eyed of what she's been through. But it's the faith, it's the hope, it's nope. Cancer picked the wrong girl. We do have a picture. Can we show the picture of Tammie with Meadow? She's in the beautiful green outfit. I'm talking with George. I'm not just talking to someone in my head. So
Hey,
if we can find that, there we go.
That's my girl. That's
Where is
my
that?
girl.
Is that recent?
Recently, opening night at the Symphony. I am a true lover of St. Louis, and I love the arts. So anytime I have an opportunity to soak up the beautiful music and art scene that we have in St. Louis, I do it. That was a wonderful, wonderful night.
What did you see there?
So that was the opening night of the St. Louis Symphony Orchestra.
Oh, just
so
okay,
that
okay.
was the St. Louis Symphony Orchestra's first night, and it
Gotcha.
was in a new place because obviously Powell Symphony Hall is
Right.
being renovated.
Can't wait to see that.
Cannot wait to see the new renovations. But it was very cool to be. I always get confused. Am I calling it Stifle? Am I calling it Stiefel? Or am I calling it Peabody?
I know.
Or what is
I
it?
know.
What is it now?
Kiel Opera House.
But you know the place where the Bears are in
Right.
front.
I still
That's
call it
go
Kiel Opera
there
House.
on Market.
Well, it's just like where the Blues play. It's still the Kiel Center to me. Will always be. But then, and the Worldwide Technology Raceway is gateway. I mean, everything changes hands, and we get it from a sponsor standpoint. I get it. But we grew up loving the Kiel Opera House. You and I are both very big into the arts.
Yes.
Did you recently see something called Cabo?
Yes.
I saw that on your
That
page.
is so very cool. Yes, there's a wonderful artist. His name is Brock Seals. Brock Seals is someone with whom I am most fascinated with.
Why?
Because he's like an ultimate Renaissance man. So he's an artist. So he paints. He makes music. He's into theater. And so I'm going to have him on my show this coming Wednesday. He'll be on my podcast, and I'm hoping that people will want to hear his story. But I just find it so amazing. People who just do themselves. I think, I always end, back in the day when I was on the radio, I would end my show by saying, life is death without adventure. And adventure only comes to those who are daring and willing to take chances. I admire and respect someone who's willing to say, this is what I want to do, and trusting that God, is going to provide for you. If God brought you to it, this is what I believe. If he brought you to it, he's going to see you through it.
Absolutely.
Okay?
That's one of my favorites.
Brock is like that. He is an artist, and he is committed to his art, and I just want to sit down and talk to him because through stories and storytelling, we can learn a lot about ourselves, we can grow, and then obviously we can learn about other people. But there's something about Brock that I think people can learn from. It's about taking chances and just doing what you think, no, not what you think, doing what's the best on the inside.
Cabo. Where was that?
So Cabo is his music is the title of his latest music project, and Cabo he put on a visual for the CD. We don't call them CDs.
Oh, we still do. Just like we call it Kiel Opera House, we still call it CDs. We don't call them 8-tracks, Tammie. My mom might call them 8-tracks.
So his latest musical project is called Cabo.
Okay.
And so at the St. Louis Art Museum, through their celebration
was.
of the 50 years of celebrating 50 years of hip hop, they have a wonderful, wonderful exhibit going on. But a part of the exhibit at St. Louis Art Museum, they've got Well, they had Cabo. He put it on. It was absolutely great, and my daughter was a part of it.
Right, that's what I saw.
It was so cool.
Have you, by the way, have you been to Cabo San Lucas?
Never.
No. Okay.
Only through Brock Seals' music.
Can you imagine she and I unleashed in Cabo? It needs to happen. I go to Cabo every other year.
Monica,
I love Cabo.
Listen, Monica,
What?
you are such a good girl.
Not in Cabo. Not in Cabo.
Okay.
No, I'm kidding.
I say that like I'd be hanging off the rafters. I always really wish that I could have been that one. I have this personality, and everybody always thinks that I'm that one. Ooh, she's
wild.
and she's come over here, girl. That is so not me. It really isn't.
No, she's full of life.
Thank you.
As am I, and
you.
you're just you love life, and I think because we have these big personalities, it's believed that you're a wild child.
Thank you.
We're not wild children. We were raised right by our mamas. How was your mom?
Thank you for asking about my mama. My mama is fine, and she's going to love the fact that you said I was raised right.
She was.
Thank
And
you.
I remember you calling her when you were at my house.
Yeah, probably because I
We
needed
were a little wild that night.
probably needed permission for something.
You needed
Okay.
to let her know you were staying at
Did
my
you tell?
house.
You have to tell everybody that you and I had anatomy and physiology class. Jackie Graham, one of the best teachers
Oh, yes.
that you and I probably ever had in life. Jackie Graham was an anatomy and physiology teacher, and I passed that class because of Monica.
What? Wait a minute.
Monica was so prepared all the time.
Oh, I don't
she
think I
always
knew
had her
this.
homework. She always had, and I'd say, Monica.
Are you saying this because my mom's here?
No. I mean it. I'd say, Monica. You know what's number 5? And Monica would have that arm up like this, and she'd be writing, and I'd say, come on, Monica, come on, and she'd do one of these real fast. And she'd let me see it, and then she'd put her arm back up. Like you're mad at me. Come on, Monica, I'm sorry.
I do not remember any of that.
Yeah, well, I do.
Oh, good. I'm glad I helped you pass.
I passed. Thank you so much.
You're welcome.
Yeah, I would tell everybody, I give credit for graduating from high school, Monica and Craig Hopton. Because if it weren't for truly, and I mean this, if it were not for Craig Hopton, I would not know. I'd still be over there on Dunn Road right now.
What is it these days, by the way?
I don't know.
It's a
St. Louis
Christian-
Christian
Yeah,
Academy
yeah,
or something?
yeah.
Hi to you guys
So
over there.
St. Thomas Aquinas, by the way, for those of you who don't know, St. Thomas Aquinas then merged with Mercy. It
Right.
became what we went to, which was St. Thomas Aquinas Mercy. My brother Craig was the last graduating class of Aquinas. We were the first coming in of Aquinas Mercy. Then Aquinas Mercy merged with Rosary, became Trinity, and now none of it is any longer, right?
Yeah, and it makes me sad. Yeah, there's our school.
We had
that
such
was,
good times there.
That was the gym. That was the boys' side of the boys' locker room. That side. Not that I would know about that, but I
that's
just
actually-
know. Is that?
Yeah, though that the funny thing is you talked about working out. That is literally I have
Look
to
at
think.
you, girl. You look good.
Look at you.
You do. Look at you.
Coach
Sitting there in that
Drake
little chair
is the
in
one
your
that
jacket.
introduced us to working out when I was 15, and we had to train in the boys' side. I'm like, it stinks in here.
So my mother, I just pulled up a couple of report cards. My mom did. We were trying to cleaning up. Mm-hmm. Clean. Have you gone in? Never mind. Going in your mom's attic, but anyway, cleaning out at my mom's house
I'd have to go to her
recently.
basement.
Right, has just been a gold mine. Just finding. I found report cards. And I had the worst grades in physical education. Usually straight D's,
Really?
D's, C's, and F's.
In physical education?
Yeah.
So what was your best?
My best
Yes.
class? Lunch. Lunch. Do
you like to cook?
I learned how to make those little soy hamburger patties.
Ew.
I can make them taste so good.
I remember
those little
the
square
pizza.
cheese pizzas.
That's
yeah,
it.
so good.
And the foil.
And the foil. I don't know. I think there were many classes that I enjoyed.
What was your favorite?
I don't know. I really, honestly, even though I probably didn't make great grades, I enjoyed anatomy and physiology.
Oh, I was
I
just-
did.
I was just gonna ask
enjoyed
you that.
I enjoyed, my choir, any type of a creative
You
class
and I were
or
in choir
a
together.
creative setting. Yes.
And that's when I was really shy. If she was in front of a microphone, my mom would tell you, she would say, honey, you have to look at the people when you sing. And I would look over their heads. I'm like, I don't want to see anyone's face. because I was scared. And she says all the time, because we talked about it earlier, she believes that the ham that I've become and the personality I have is thanks to karaoke. She
you know
swears.
What? Well, then give thanks however you have to get it done, Monica. That's what I tell people. Just however it comes out, just let it happen naturally.
Yes.
Yours came through karaoke. That's all right.
I'm telling you, we need to carry. All right, let me see. Before we wrap up with Tammie, if anybody had any look, good morning, watching you all the way from Ghana. We have a bunch of people watching from Africa because of our 10 by 3 interview that we did.
Oh, wait a minute. I was going to say, what's up. Oh, because my former fiance is from Accra, and I was going to say something to you this morning, and I was going to say what's up, and I can't even say it now.
No?
Nope, I can't.
Okay.
But good morning to you, or good afternoon to you in Ghana.
And this is
good evening to you in Ghana.
You were engaged when?
Okay, Monica. A million years ago. From the time I was 20 until I was 27.
Oh.
And so, yeah. I was. I did that. And then I didn't anymore. And that's it.
Okay. She's coming back on the show. We're going to go deeper.
We have to do love talk.
Are you involved with anyone right now?
No, I have, honestly, for the first time in my life, I don't have any romantic aspirations. I have spent, Monica, entirely too much time in my life, too much energy in my life, thinking about romance and love. Honey, we live in some different times. Right now, I got my mind on Jesus and taking care of my daughter.
And
These
yourself.
are probably and myself and being healthy. Would I like companionship? Yeah, but I don't. Listen, girl, the dating pool. The dating pool has a little urine in it.
Oh my
okay.
God.
Can I say that this
You
morning?
absolutely can.
There you go.
Why do you think? Why is that?
Men have too many choices, and people have too many choices. And at this stage in life, I don't know that marriage, and I shouldn't say that. For me, I don't know if marriage is for me. I think marriage is for young people.
I didn't get married until I was older.
Yeah.
Right?
Yeah, but I am still much older than you, and I have never been married.
I know, but here's the thing. There are a lot of people, and that's why I said earlier, you never say never. You also know that anything can happen at any point if it's God's timing.
There you go.
And so we don't know, but she is an incredible soul.
Yeah, God has
You'd be quite a catch.
God has a sense of humor when it comes to my romantic life. Let's just say that. Hardy har.
I'm not going to play matchmaker, even though I used to love to do that, but
I don't even you wouldn't even know my type. My type
you shouldn't have a type, right? That's when we have types, that's the problem.
Yeah, but you wouldn't even know. You wouldn't even be able to pick it, Monica. Oh. You wouldn't even be able to pick it.
I feel a challenge.
No. Could she pick it? No, she could never. You can never.
Never say never.
Okay,
you never
fine.
know.
Okay.
Okay. All right. Let's see. Okay. So we said, Ghana, good morning. Good morning, everyone. Good morning. Yes. Let's see. Anybody have any questions? Oh, my gosh. There's a ton.
That was really going to be impressive.
Love the conversation, laughter and energy. Great high school memories. Great to reminisce.
That was nice. Thanks.
Joanne Oldacre.
Joanne
Tammy,
Oldacre.
You have always had a beautiful voice. See?
Oh, thanks, Joanne. And
She's
say,
a
Joanne,
sweetheart.
I remember Joanne's brother.
Yeah. Will.
Right?
He helped our soccer team.
He helped the soccer team.
Joanne and Will, both sweet souls.
So sweet.
Yes. A survivor and a beautiful cheerleader. Love your strong faith.
Oh,
good morning.
Thank you.
Good morning. I love the day starting the day. Okay. Tammy, I love your energy.
Thank you.
Love the energy
Thank
around
you.
this girl at 7:40 in the morning.
Thank you.
Everybody. Oh, someone just said that they were a goalie. Okay, so anyway, I would love to bring you back on. I want to continue to follow this. So we mentioned that she survived and now she's a fighter. So where are you right now with regards to treatments?
So right now I am waiting to begin proton therapy treatment.
You don't know when that starts?
So I've been mapped. So my body's marked up like a subway in Harlem. You know, I got all these little pieces of tape and scratches and little things marked on me so that when I get in that, remember that tube?
Yes,
you saw
the
that tube? So when I get in that little tube and they go, me, then they'll know exactly where to do it. Me, they'll know exactly where to go.
What was the one video you sent us that it's all black taped and it's got things all over?
That is a mold that they use. That's a mold that they use for my radiation treatment.
Wow.
So you lay in that. So I would lay in that for about an hour. to get treatment. And the cool thing about this mold is when it was done, they said, we're going to pitch that. I said, no, I worked for that thing. I said, give me that thing.
Wall.
So I took that thing home. I did. And I called Brock Seals.
Oh, God.
I said, Brock,
Turn this into something
turn
in your play.
this into something. And he says, well, give me some inspiration. I said, I listened to Prince the whole time. So he took it, and he wrote Prince lyrics, all from one of my favorite albums, Around the World in a Day. And he wrote Prince lyrics on it, and he has it in purple. And I'm like, it's just the cutest, it's the greatest thing.
That's
lovely.
incredible. So you talk about creativity.
Now, it's, I have to find something to do with it. I thought maybe I'll give it to Siteman. Maybe I'll share it with someone.
Maybe raise some money for something.
Maybe I can auction it off.
Yeah.
But yeah, it's so gorgeous. It's so beautiful.
There's a video we haven't shown yet. I don't know if George has it, but it's you laying there, and I just wanted to know what was going through your mind at the time. I think it's during one of your treatments. You got everything plugged up on you. I mean, I've seen so many pictures and video of Tammie as she's going through.
I know the video. That was when I was first getting, and I was so scared. I was having my port. I was having my port put in. And so it was a procedure, and it just, they knock you out a little bit, and they stick the device inside your chest area so that you can receive chemotherapy through this device. I'm such the wrong spokesperson, because really I've gone through this, and I should be able to say it's the Sorka Shraka. But I just wanted them to fix me. I don't know what it's called. It's
you
the
weren't
port
going back
thing.
to your anatomy and physiology days.
There you go. And
I wouldn't have had the answer for what those were.
And you wouldn't have had the
No,
answer.
the trakalaka.
The trakalaka thing. But let me tell you something. That trakalaka thing worked, baby. It
Don't
did.
you want her and I to do a show together?
It did. It worked.
You and I would be great together daily.
I would enjoy it.
Absolutely.
I really, really would.
Oh my God, I love this woman. Okay, so I want you, because we are both faith-based, I want you to send all your prayers to her, because I want yet again for the bell to be rung and for the survivor to follow that name, not fighter, no more. What I would like to do, and I was telling my mom this, I don't want to tear up here. I don't know why, but I'm being called back to Team in Training, which is an incredible organization for Leukemia Lymphoma Society. And it is training for those that we've lost, for those that are fighting in memory of, in honor of. I did, with my mother, after my dad passed, we did a half marathon. Then I did Hike for Discovery in honor of a dear friend of mine who owns Mark Anthony's and Christopher's, and his grandfather died. My brother had Hodgkin's disease, obviously remembering my dad. But because you're going through this right now, I would like to do something in your honor. So I am being called back to Team in Training. So for Tammie, in honor of my father, and in honor of Bobby Peoples, who we just lost, I'm going to try to get Rosie involved in this. But have you ever done anything like that? Have you ever trained? There are people who have been brought to it that were like, yeah, I was never involved in athletics or anything, but oh my gosh, to do this, you remember, Mom, the people who were literally going through treatments that blew me away.
What are you telling me? What are you going to do?
I don't know. So would you
going to work out something?
Well, they do like walks, they do runs, they do hikes, they do triathlons, they do cycling. Would you be involved in would you do any of that?
Yes.
You would?
Yes.
Breaking news right now. She and I need to get together, which would bring me and you back together on a regular basis, which I would love.
Monica, I'm going to tell you something, okay? You are all super athletic and everything. Let me tell you something. Don't get mad at me if I'm if I'm going a little slow, because let me tell you something, girl.
To me, what it's about...
Even if I were like at 100% health, I'm still not keeping up with this.
It's not about running a race.
Okay.
It's about doing it for a cause. It's about the sheer exhilaration.
I am there.
Because the woman that I did it with when we hiked the Grand Canyon, it wasn't about me, let's go down really fast and come up. It was about empowering her to know that she could do it.
Okay, well, I'm down for that.
Yes.
Let's go.
All right, follow along with the journey, and maybe we get a team to be involved in this. So Team in Training, I will be reaching out to you because I keep feeling called back to it. And when I knew she was fighting again, I thought, well, what can we do? As she does that fight...
Do we have to get going early in the morning?
No.
Okay. Okay, then fine.
Is this too early for you? A lot of people have told me, Monica, you got up at 1:30 in the morning for 30 years. You could have slept in and done an afternoon
That's what
show.
I'm saying. When you told me, when you said 7, I said 7. What is she talking
7 in
about?
the evening?
No, 7.
Are we having happy hour?
7 p.m., girl. I will wake up for you, Monica,
I love you for
any
that.
day.
I love you
Okay,
for that.
girl.
I told you,
mean
I
it.
told you we'd go well beyond 8 o'clock. Okay, because you and I are both very faith-based. Hang on. Love the conversation, the laughter, and the energy. Great to reminisce. Absolutely. Great high school memories. My girlfriend Nancy just married for the first time at the age of 64, and she's much younger than that, by the way.
Hey,
Tammy,
Nancy,
I am with you.
Congratulations.
Too many boxes to check off for the next man in my life. That's what Marilyn says.
Come on, Marilyn. See, you understand where I'm coming from, don't you,
All right,
Marilyn?
if you know the show, you know that I do this. Marilyn, by the way, is the one that gave me the Jesus Calling. These are the devotionals from Jesus Calling, which is great.
All right.
100 Days to Freedom.
Okay.
Shame,
Okay.
anger,
Okay.
fear and anxiety,
Okay.
depression,
Okay.
overeating. I don't really feel that one today, but what would you pick? Shame, anger, fear and anxiety,
Look,
or
I'm
depression?
going to go with the anger one.
Good one. That's how we're going to wrap up the show. We will have 100 Days to Freedom from anger.
Both inside and out. Envita isn't your typical med spa. They're a multi-specialty medical spa and wellness center serving St. Louis and its surrounding areas. They have ketamine for mental health and pain, IV therapy, medical weight loss, and aesthetics treatments. As board-certified anesthesia providers, Envita can ensure that their advanced treatments are provided safely with minimal to no pain. So let Envita take care of you. Call 314-394-0950 to book an appointment or online envitahealthandwellness.com.
And welcome back. It is 8:20. We're wrapping things up with my dear friend Tammie Holland. You'll see her on camera in just a second. But this is the one that she chose, and this is 100 Days to Freedom from Anger. Day 12 of 100 Days, Anger and Grief. He heals the brokenhearted and bandages their wounds. That's from Psalm 147, verse 3. Grief is a universal experience, yet each person will react and respond in his or her own way. You might have heard the concept that grief has stages that occur. In fact, there's a psychiatrist, Dr. Elizabeth Ross, who said that giving names to the stages in the grief process, denial, anger, bargaining, depression, and acceptance. It's something, the phase we all go through. Grief is caused by loss of any type. Understand that, not just death. A person can experience loss in many ways and might not even recognize how grief is affecting his or her life. The anger stage occurs when you have to move on, and the loss you experienced is a stark contrast to the reality that you had actually hoped for. You will experience frustration, irritation, and say things like, "It's not fair. God failed me. Why me?" You might not realize you're becoming stuck in the anger stage because your argument feels justified. Sometimes the loss is so far removed from your anger that you might not connect the dots. You might not recognize that the anger you experience every day is tied to a loss in your past. I do a lot of timeline therapy with my life coaching clients, and we go back to the past where they're frozen and stuck. You might be stuck in the anger stage as a defense to keep you from being vulnerable to experiencing loss ever again. And of course, that's impossible because loss is a part of life. What can you do if you recognize that your anger is anchored in grief? Attend to the loss through reading about grief, counseling, maybe even a grief group. Recognizing that your anger might be a grief stage where you're stuck can allow the healing to finally begin. Isaac Rose said, "I sat with my anger long enough until she told me her real name was grief." Nicholas Sparks, you know I love. "After a while, the anger I felt just sort of became part of me, like it was the only way I knew how to handle the grief. I didn't like who I'd become, but I was stuck in this horrible cycle of questions and blame." And Susan Albert said, "Sharing our stories can also be a means of healing. Grief and loss may isolate us, and anger may alienate us. Shared with others, these emotions can be powerfully uniting as we see that we are not alone and realize that others weep with us." Here's today's prayer. Lord Jesus, my heart is broken with grief, and I am recognizing the damage it is causing in my life. I ask for your comfort and care as I offer to you this very painful wound. Thank you for your grace and mercy in my life. In your name, I pray. Amen. Well, that was a pretty powerful one, Tammie.
And it just hit right on. Perfect. That was perfect for me. Thank you.
You know, here's the thing, and we never know what a person's going to choose, but I swear he chooses it.
Hey, I'm with that.
Every
It was
time
great.
this happens.
It was great.
Before we wrap up, Dawn
Yes.
Harvey, and I don't know how to say Dawn's last name. You
From
think
high school, Dawn Harvey.
Tram, though?
Yeah,
Okay.
yeah, Dawn
So
from
Dawn went to
school.
high school with us.
Yes.
She said, this is so special. Falcons for life. You go, girls. True inspiration.
Onward Falcons, fight for gold and blue. Rah, rah, rah!
I just want to give you a big hug. I love you.
How we gonna do it, girl? And I love you back. Oh,
I'm coming to you.
thank you so much.
I would love for you
Care.
to come back.
Yeah, are you sure?
I would.
Okay, I'll be back.
She will be back. I
Thank
know you
you.
will want that. I love you so much.
And I love you.
am
I
here for
really
you.
do. And I am so happy for you.
Thank you.
It has been a true pleasure, and I mean this, to know you all of these years and to watch your career and watching how you have you just soar.
As do you.
Thank you.
And I cannot wait to see. There's so much to come for this woman in life. She's got a lot of life left to live. So understand that. We will be keeping an eye on everything that she's doing. And I want you, where can they watch? Is it audio,
yeah.
audio podcast?
Well,
Or
you can
video?
both audio and video, but grab me on Spotify, Apple Podcasts, anywhere you would listen to a podcast. Just search This Week with Tammie Holland, and it'll pull up. Spotify is one of my favorites. You can just go and check out the interview right now on Spotify with Denise Times, and then follow me on social media. This Week with Tammie Holland on Instagram and Facebook.
Perfect. Yes, please do so. She's got a lot of followers, and you can just continue to see this road and this wonderful journey that she's on.
Thank
I
you.
love you, my friend.
I love you back, my friend.
All of you.
Thanks
Again,
for being
wait.
a friend.
Oh, she's
Boom,
saying,
boom,
I
boom,
told you.
boom.
Oh, look.
What? No.
What's that?
What?
Look.
Oh, you know what that is? That's God, girl.
Yes, it is.
What is that? No, somebody's got.
What? No.
That little light bounce.
You
that
saw
little...
it, everyone. I
What?
believe that. I believe that is a spirit. I believe it is.
Well, then
my
he liked my
father.
singing. Thank
Yes.
you for being a friend.
Look, see? Where- we need it back.
Travel down the road and back again. Sing it at home. Your heart is pure. You're a pal and a confidant.
That's how we're going to end the show. Remember, go out, be anything you want to be. Be a singer. Go grab hold of those reins and take on this world. But before you're anything, please be kind. God bless you all.